Okay. About 2 years ago, they kept telling me I have baby cataracts, and so we just went with it. And then all of a sudden, I kept cleaning my glasses and telling my husband that I just can't see. There's something wrong with the glasses. So I called and made an appointment with my optometrist. She did her exam, and she said, I could sell you glasses, but they're not going to help you. You have major cataracts. And so she gave me Adam's name, and I came up here, met with the staff, and they were excellent. And is it Gabby?
The patient coordinator?
Yes. And then finally, after we did all our preliminary, Dr. Abroms came in, and he said, you've got 2 cataracts on one eye and 1 cataract on the other. And he said they're not going to go away. The only way we can get rid of them is to do surgery. So we set the surgery up, and we waited about, 3 weeks or something. Process was easy. Your staff kept me informed. They answered all my questions and helped in any way we needed.
And kept me included also. I was right with her for the whole thing.
And so the day of surgery, we went to, where did we go first?
It was in Aurora Grande.
Aurora Grande. And we had the surgery. It took about 45 minutes for the pre-op. We did the surgery. I came out of the surgical suite, and
It was amazing. Both hands were in the air going, I can see, I can see.
and it was wonderful. So
Yeah.
we did that one, and then we did the other one. And I can't praise your staff, the doctor, everyone, the surgical staff of all that. We've been to all 3 surgery centers now, and it was excellent. If you want a doctor you can talk to, if you want a doctor to answer your questions and all your concerns, you have to have 100% trust and faith in a surgeon that's going to do such a critical surgery. And Dr. Abroms is the doctor to choose. And I can't thank him enough for bringing my sight back. It's amazing.
Yeah.
Yep.
Okay. Keep on talking.
Oh, I came out into the waiting room, and it was like, oh my God, I can see colors, I can see shapes. And colors is, I'm still amazed, and it's been 2 months that the colors I can see.
What was really interesting is just how much she couldn't see, but your eyes get used to that and your brain compensates for long periods of time until finally it gets to the point where you know that you just can't see. You think it's your glasses first, and then you realize no, it's then when you find out you have cataracts, that's what it is. And then when the cataracts go away and the surgery is performed, it's like a miracle. It's like you've been blind all your life. And that's the way she came out of the room. 15 minutes. Came out of that room, and there were 4 or 5 people in the waiting room at the time, and they're just like going, wow, this guy must be good, because she just goes on. And as she's walking out the door, I can see that sign across the street, and I can see that it's a green light, and I can see this. It just was amazing. All the way out to the car and all the way home was the same way. Look at this. Look at this. It was amazing. 15 minutes, and it was done.
Yep.
So.
I had to go back last week because I developed a film over the cataract, and he said it's about 80% of patients has this happen. So I went in, you guys did the laser, done, and I asked him if the reoccurrence rate, and he said no, there's 0. So I'm just absolutely thrilled.
Unlike a lot of doctors which don't have such a great bedside manner, he's just like your your buddy right off the bat, and not only good bedside manner, but tells you up front. Now here's what could happen. You know, it's not 100%, so these are the type of things that would happen. And he told us about that film that develops in a lot of people, and easily corrected, and you know, in years down the road, if there's a problem or something, we can easily correct anything with laser. And so, and he delivered 100%. So
The package I went with is just the basic lens implant. Kind of frugal here, and so we just decided I wanted just to be able to see distance. I was used to wearing glasses for all my up close work, so my target was distance.
Okay.
She caught a couple different things. She caught the film because I had gone for my last post-op. And she said, you know, there's something that just doesn't look right. She said, let me call your guys' ADV Vision. And then your office called me and said that he would like to see me.
Nice.